So for our interview expert today, I have my friend Elizabeth Black here, who works with the Department of Mental Health and Substance Abuse Services. Elizabeth, would you mind telling us, what do you do?
I am the Wellness Program Coordinator, and so my position is funded through the TSET Foundation, the Tobacco Settlement Endowment Trust, and they give us a reoccurring grant every year to support a wellness program within the department, because our consumers, we know, die about 20 to 30 years earlier than the general population. Wow. Especially working in the public sector, and so we've realized that it's really become a priority, or we need to make it a priority to start addressing physical health as well as mental health. And plus, we know that the two are very much integrated and intertwined. And so while we have the mental health staff, the psychiatrists, the case managers, the therapists, my job is working more with the physical health side for the department.
Okay. What all comes under that umbrella of wellness? What sorts of problems?
So wellness includes tobacco use. That's one that's really high for our population. And so we do a lot of work connecting our consumers and then staff so they can connect their consumers to resources to help them to quit. We know that that is the #1 preventable cause of death. Not just from our population, but for the general population as well. But because we have such a higher level of smokers, we see a lot more death related to tobacco use. We're also focusing a lot on nutrition and physical fitness. It's the same issues. A lot of our consumers, they're on limited income. They may never have learned how to eat healthy or how to cook or even like basic living skills. And so there's a real push to make sure that we are incorporating things like eating healthy and getting exercise into their treatment plans. So that way we have more of a holistic treatment plan, and we're not just addressing the symptoms of their mental illness, because ultimately what we're seeing is that's not what is killing them. It's these issues they have related to obesity and tobacco use.
Okay. So what sorts of things do you do on a daily or weekly basis? Like what's a work week like for you? What sorts of things are you doing?
Well, right now, currently, I am working on developing a new training for the department. It's a wellness coach training in which we are going to offer to our staff, and they will come in for, it's a 3-day training program, and they basically learn basic foundational knowledge of physical wellness as it relates to behavioral health, and afterwards they will be certified as wellness coaches. And so that is one that I'm developing right now. And so a lot of our job, what we do is training. Prior to this wellness coach, we've been doing the Well Power trainings, which you help us with, where we travel around the state and we teach our clinicians and our direct care staff about basic health and wellness information, so that way they can take it back and incorporate it in their facilities with their consumers, be it the treatment plans or running wellness groups, or even how as staff they can become more well, and how also to work on beginning to create a culture of wellness.
Could you tell us just a little bit about your training background or your path to get to the interesting job you have now?
Yeah, sure. I started out my collegiate career at OSU, go Bucks. I got my undergrad in psychology, and then from there I went to Texas Tech University and I got a master's degree in rehabilitation counseling. And then I went to work in the substance abuse field and got my LADC, which is licensed alcohol and drug counselor. And I'm currently working on getting the hours I need to become an LPC, which is a licensed professional counselor. I always have to think about that one. And so I've been with the department for about 10 years throughout all of that. I started out as a PCA, which is like a mental health tech, which is where you work on the dorms, getting paid $8 an hour, really kind of starting out at the bottom. But I'm glad that I did that, because that gave me some really firsthand experience of what it's like working in a psychiatric hospital. And then from there, I worked as a case manager for a few years, and then I was a clinician, a therapist. So I put in about a decade of direct care, which I really, really enjoyed, but I've also been really interested in the administrative side of the field and for the department. And so when this position opened up, I applied for it. I was very interested in it just because my own wellness journey has been a work in progress for me. I really had to, I'm not one of those people where wellness comes easy. You know, I've really had to learn how to eat healthy and how to take care of myself and make my self-care a priority. And so I really feel like I can empathize with a lot of people who struggle with wellness. And so I just felt like this was a fantastic opportunity, and I interviewed for it, and I was so fortunate enough to get it. And I'm in my second year in this position right now, and I love it.
Mm-hmm.
It continues to inspire me. Every day I come to work, I feel like I make a difference, and I don't think that I could ask for much more.
Mm-hmm. You mentioned earlier the wellness coaches that you're training. That's kind of a new thing in the mental health agencies in the field. It might be a job some of our students in the class would be interested in.
Absolutely.
Could you say a little more maybe about how somebody, what background you look for in the wellness coaches you're going to be training, and maybe how somebody might have a path if that was something they wanted to do?
Right now where the wellness coaches stand, they will probably be clinicians that have an interest in the wellness side of mental health treatment,
Okay.
behavioral health treatment, I should say. They will serve as kind of a liaison between the behavioral health side and the physical health side
Mm-hmm.
as we move to health homes and we start bringing primary care physicians into mental health treatment facilities. And so I would say probably what we're going to look for is people who are professionals in the field, but who also have a strong interest in wellness.
Okay.
I know a lot of these people are going to be the people that we have designated as our wellness contacts.
Mm-hmm.
And the reason that those people were chosen as the wellness contacts for their facilities is because they've shown some sort of interest in wellness or have really been a champion for their staff and their consumers there.
Mm-hmm.
It's going to be a growing field, a growing position.
Mm-hmm.
There's going to be a big demand for it. And so again, if you're a person who wants to work in the field that also has an interest in wellness, that's a great way to kind of combine those two interests into what will also be, I imagine, a very rewarding field, because I think a lot of good's going to come from it.
But their first step might be going for that training as a counselor or as a
Right.
LADC or something. That's terrific.
Yeah.
Well, Elizabeth, this has been very informative. Thank you for your time.
Absolutely. Thank you.